The reason I chose my residency is because I appreciated the two sides of academic and community medicine that we get to do. We are associated with the university. It's workshops that we get to do. We get to collaborate across the university programs. I've been working on a pediatric lifestyle, which is for patients with pediatric obesity. So I've created a standard work and gotten to collaborate with other residents and other programs. We get to engage with the community in a great way. We're ingrained in the community. We get to work with community partners often through things that are locally done.
I chose Broadway Family Medicine as the place for my residency training because I wanted to take care of patients that are underserved, alienated, and vulnerable, and I wanted to do that in a place that places emphasis on providing care that maintains dignity for our patients and that provides a space for us to advance social justice through medicine. And I found that at Broadway, and that's why I love it.
I interviewed at a million places because it was virtual and I was able to really get the full breadth of finding out what's available. But I also did a rotation here before I applied here. And it was hands down my favorite place just because I really felt like I belonged with a group of individuals who really prioritize all types of stigmatized medicine. This is the place to be if you want to serve any kind of underserved community, if you're interested in gender care, if you're interested in social justice, reproductive justice, addiction medicine,
care for prisoners.
Yes, prison medicine, anything that you can think of where there is a group of people who is not being appropriately served in our current system. This is the place that you can get an education and experience serving those people.
The reasons I chose Broadway and the reasons I love Broadway are because I can be with people and work with people who share similar values to myself. I know that I am supported in everything I do here. Residency is hard wherever you go, and here I always know that I have support. We're developing a cohort of doctors who are really starting to represent the community that we face and that we can identify with our patients on a deep level, which I think adds a really important dimension to patient care. And lastly, I know that everyone, regardless of their background, really cares about our patients as complex human beings. Beyond the acute complaint that brings them into our clinic or hospital. I know that they're in great hands and that we provide good care for them as a team.
After the murder of George Floyd, we were involved in a supply drive that took place in our parking lot. This was a great way that we got to engage with the community and help provide services. So we had basic medical supplies and some food. And then combined that with community partners who were helping to supply the area of North Minneapolis. And this was an important thing to us because of the riots and the looting that happened afterwards. A lot of our patients were unable to access grocery stores or pharmacies for those little things such as diapers and Band-Aids. And these are all little things that seem like small but can have a big impact on lives. So getting to work with the community and provide that was a great opportunity that we really enjoyed.
I chose this program for a number of reasons, but one I was pleasantly surprised to find was how much I enjoyed working with our Suboxone patients. We have quite a strong addiction medicine program at Broadway, having a couple faculty who are quite experienced in this regard. I found that this is a great way to kind of bring young adults and middle-aged adults back into the fold of primary care where they wouldn't often otherwise be accessing the healthcare system.
Many of our faculty members are really involved in the Minnesota Academy of Family Physicians, and as a resident I've had a lot of opportunities to get involved in the Minnesota Academy of Family Physicians myself. One of the things that I got to do was testify in front of the state legislature in regards to an insulin affordability bill that actually ended up passing our House and Senate and is now on its way to providing a lot of affordable insulin for all the citizens of Minnesota. And that opportunity was only available due to my involvement with this residency program.
I met with residents across the university that were also interested in leadership, so we gained skills and got to learn how to apply those skills to our, both our residency now, but then our future careers. And through that, I was able to get involved in some committees across the university, which has been a great opportunity to develop my skills as an academic professional. I've gotten to develop curriculum for residents as teachers because teaching is such an important part of our residency. We love having med students, and being able to teach them well is important to us.
I was really happy to have a lot of the procedural opportunities that I've had here to really gain skills not only within the clinic, doing full spectrum procedural and opportunities for my patients who may otherwise have barriers to some of that care, but also in the hospital and doing some of those advanced procedures, not only with our family medicine faculty, but with the emergency room and anesthesia providers who've helped me to gain competency in central line placement, arterial lines, paracentesis, thoracenteses, and just having the support to really explore that opportunity within the hospital and feel that I can bring some of these skills out to my patients and have some of that fulfilling practice of true full spectrum family medicine.
Focused. We work with a lot of community doctors in the hospital. We get to see different sides of medicine. We talk about the art of medicine, and so we get to see community preceptors who teach us kind of some of the differences in how to handle things. We get to work with other family med docs who come in and do deliveries on labor and delivery. That's a great opportunity to get to know some of them, but also to see the way that prenatal care is handled with different populations.
I wanted to come to the North Memorial program because I wanted to learn with and from both residents and faculty who are passionate about family medicine. I wanted to gain skills in advocacy. I wanted strong inpatient training. I wanted to be a part of intentional community partnerships. I wanted to engage in difficult conversations about power, privilege, and health disparities. And I wanted to be a part of a team who really care about our patients and one another. I found all of these things at North Memorial.